Over the years, I've lectured extensively on heel pain and other overuse injuries in sports medicine, and I became aware of a growing body of evidence that shockwave therapy was an attractive alternative to surgery when these conditions fail to respond to conservative treatment. I was still a little skeptical of the technology until about 5 years ago when I began noticing more and more significant research giving fairly compelling evidence that this technology works. And I made a decision that I needed this in my practice. At that time, I decided to research the various technologies available, and I went to some colleagues and friends of mine in the American Academy of Podiatric Sports Medicine. This is a group that I was a past president of, and I have great respect for the people and the leaders of that organization. And without question, the recommendation was to go with the EPAT technology that's provided by Curamedix. Both the technology and the Curamedix company were highly recommended, and based upon that recommendation, I purchased the machine. And I will say without question, everything that I heard about the device and the company came true. The training was excellent, the support before and after the installation of the technology in my office was excellent, and more importantly, this technology works. I have been amazed and gratified by the results in treating Achilles tendinopathy, insertional Achilles tendinopathy about the calcaneus, including bursitis, plantar heel pain, and medial tibial stress syndrome in the runner. Just recently, I had a patient come back to me after I performed shockwave on him. He had had a 2-year history of insertional Achilles tendinopathy associated with bursitis at the posterior aspect of his calcaneus. And I had already tried everything on him, including long-term boot immobilization. And when we received the EPAT machine in our office, I convinced him to come in and be a candidate for treatment. And after 3 treatments, I'm happy to say he came in last week and was thrilled to say for the first time in 2 years he's running pain-free. An experience like that is unlike anything else you can have in sports medicine, where you get an athlete back to activity, they're running, they avoided surgery, and they're back enjoying their sport. So thank you, Curamedix, for providing that for me and my patients.